Okay, so good morning once again. My name is Becky Dale from Minnesota Communities Caring for Children, and I am very excited to introduce Melissa Adolfson, who will be presenting today on the topic of fighting and using ACEs data from the Minnesota Student Survey. Melissa very graciously agreed to not only do this presentation at our statewide gathering for collaboratives earlier in May, but also to repeat it here so that we could share it with more people and also use it going forward, because she's really been able to get at some of the information that we have in Minnesota about ACEs through the student survey and how protective factors can make a difference. So I'm very excited to both have this information and to have Melissa working with us to gather it and present it. I was just chatting with Melissa before we started that she's been actually working with student survey data since 2007. So she's done a lot of assessing and pulling data from it and sharing it with others around the state for a long time. Many of you maybe know her. With that, I think I'll turn it over to you, Melissa, and let you add anything further you'd like to say and take us away.
Okay, great. Thank you so much, Becky, for the introduction. And welcome, everyone. Thanks for joining us this morning on the webinar. As Becky said, my name is Melissa Adolfson, and I am currently the lead epidemiologist for the Minnesota Department of Human Services funded State Epidemiological Outcomes Work Group. As Becky noted, we've done a lot of work over the years with Minnesota student survey data, not just looking at ACEs and protective factors, but also a number of measures of substance use, mental health, and other risk factors. But this morning, I'll be specifically focusing on sharing findings from the survey on ACEs and protective factors, and discussing some strategies for using your local Minnesota student survey data to improve community health and well-being. So just quickly, for those on the phone who might not be familiar with the Minnesota Student Survey, it is a census survey that's conducted every 3 years, and it's a collaborative effort between Minnesota Public Schools and the state departments of Education, Health, Human Services, and Public Safety. It was last administered in the first part of 2016 to students in grades 5, 8, 9, and 11. In 2016, we did have 85% of public school districts participating statewide, which gave us a really robust sample size of close to 170,000 students, which really allows us to dig in and take a nice look at the data and associations between various factors like ACEs and protective factors. So the data presented in this webinar this morning will include only 8th, 9th, and 11th graders. Many of the items that we'll be sharing today were not asked of 5th graders, so we won't be including them in with the data. And as I'm talking about the Minnesota Student Survey, I just wanted to put in a plug. The state is gearing up right now for the 2019 Minnesota Student Survey. So if any school districts in your area are maybe waffling as to whether or not they want to participate, I would strongly encourage you to meet with them and ask them to reconsider, because this is such a valuable source of information on protective factors and risk factors that can really help us with planning and prevention efforts. So many of the presentations, the reports, fact sheets, and infographics that the State Epi Work Group has produced over the past few years on ACEs include these 7 ACE items from the Minnesota Student Survey. The measure of incarcerated parent or caregiver includes students who said yes to at least one of 2 different questions. Do you currently have a parent or caregiver in jail or in prison? And or have you ever had a parent or caregiver in jail or in prison? And this happens to be our most prevalent ACE in Minnesota. The measures of living with someone who drinks too much, who uses illegal drugs, experiencing verbal abuse or physical abuse, or witnessing household domestic abuse are all single question items from the survey. And then that last measure of sexual abuse is a composite of 2 separate questions. So that includes students who were sexually abused by a household member and or by somebody outside of the home. Some communities have expressed interest in adding other ACE items to the ACE score, and I've seen other presentations and reports that do that. Two, that the state EPI work group has recently added to a new report on the cumulative impact of multiple protective factors in buffering the effects of ACEs include not only these 7 items, but also youth who have experienced bullying weekly or more in the past month, and youth who have ever experienced dating violence. And at the end of this webinar, I'll provide a link to the website where you can find that report. It should be posted today or tomorrow. And while our reports have not included measures of poverty as part of the ACE score, as some other communities have done, we do take a look at disparities faced by youth in poverty. So both whether they have higher rates of ACEs and or lower prevalence of protective factors. So because no 2 ACE scores are alike necessarily, I always like to caution and say, if you're looking at national ACE data from other states, or even other Minnesota data, such as ACE scores for adults from our behavioral risk factor surveillance system, or the College Student Health Survey, to take a good look at the number of ACE items included in that ACE score, as well as the specific types of ACEs that are included. So in this next section, I'll walk through some state level findings from the 2016 Minnesota Student Survey. So as I noted before, our most prevalent ACE is youth reporting currently or ever having a parent or caregiver in jail or in prison. And this is followed by experiencing verbal abuse, which was reported by about 1 in 7 students. Students were least likely to report household drug use or sexual abuse. When looking at an overall ACE score from 0 to 7 using these items, we fortunately see that about 2 in 3 Minnesota 8th, 9th, and 11th graders report 0 ACEs. About 1 in 5 report 1 ACE, and 4% of students report having 4 to 7 ACEs. And while 4% may seem like a somewhat low number, that represents over 4,000 8th, 9th, and 11th graders across the state. I think it's also important to note that 8th graders were just as likely as 11th graders to report having 4 or more ACEs. So we know that ACEs occur early in life and really require early prevention efforts. This map shows the distribution of students reporting 1 or more ACEs across the state. So those darkest orange counties represent the highest percentage of students with 1 or more ACEs. And you can really see a heavy concentration in north central Minnesota. We also see a similar clustering of high rates when we look at maps showing data on suicidal ideation, substance use, and other measures from the Minnesota Student Survey. And I will note that those counties that are shaded light gray that have no data are lacking data because we didn't have at least 2 school districts contributing to each grade level surveyed. So a county would have to have 2 or more districts that surveyed 8th graders, 2 or more districts that surveyed 9th graders, and 2 or more that surveyed 11th graders to be included. That doesn't necessarily mean that there are no data for your county. And at the end, I'll let you know where you can find district level data. So this table presents some disparities that we see from the 2016 data. When looking at race, ethnicity, students who identify as American Indian or Pacific Islander are least likely to report having 0 ACEs. We also see that students who identify as gay, lesbian, and bisexual are considerably less likely than students who identify as heterosexual to have 0 ACEs. A new measure from the 2016 survey is a question about gender identity. So students were asked in a yes/no question if they identify as transgender, gender fluid, genderqueer, or unsure. So there's kind of a lot going on in that category. But they were also considerably less likely to report having 0 ACEs. This tape, so here we can see a strong association between the number of ACEs experienced and rates of past 30-day alcohol use, past 30-day marijuana use, and past 30-day misuse of prescription drugs. So compared to students with 0 ACEs, those with 4 or more are about 5 times more likely to report past month alcohol use, over 8 times more likely to report past month marijuana use, and 12 times more likely to report past month prescription drug misuse. Similarly, we see a strong association between ACE score and suicidal thoughts and attempts. So compared to students with 0 ACEs, those with 4 or more are over 7 times more likely to report past year suicidal ideation and 23 times more likely to report a past year attempt. And while we're not going to present these data in the webinar today, we do see very similar patterns and dose response to ACE score when looking at other Minnesota Student Survey measures such as self-harm, depression, and having a long-term mental, behavioral, or emotional problem. And there are other resources that have been developed by the State EPI Work Group that do share these data, and I'll let you know where those are at the end of the webinar. So living here in Minnesota, we are very familiar with the concept of layering. And just as we can layer on clothing to definitely transition from sub-zero outdoor temperatures to overly warm conference rooms, we can really work to layer on protective factors for youth in our communities. And the Minnesota Student Survey, as I mentioned in the beginning, is a really rich source of data on protective factors from each level of the socio-ecological model. And so for a comprehensive approach, we can really buffer the impact of ACEs on things like substance use and mental health issues by layering on protective factors at the individual, family, peer, school, and community levels. And so now we're going to explore a few of these protective factors and how they're associated with ACEs. Some individual level protective factors that can be measured through the Search Institute's developmental assets were added to the Minnesota Student Survey in 2013 and kept on for the 2016 survey. And these include individual assets that can be categorized into a variety of constructs. And those include empowerment, so being given useful roles, feeling included and valued, having positive identity, so feeling good about yourself and in control of your life and future, being able to cope with negative experiences. And a third category that we can get from these assets is social competency. So building and maintaining healthy relationships and staying away from negative influences. And so the way each of these constructs are calculated is that each question or survey item that goes into them is rated on a scale from 1 to 4, with 4 being the most positive. So students having empowerment, positive identity, or social competency responded to every single item in that construct with either a 3, which is very or often, or a 4, extremely or almost always. So for example, to have social competency, they would have had to say very or often or extremely or always to all 8 of these items that you see on the screen. So among Minnesota 8th, 9th, and 11th graders who have 4 or more ACEs, compared to those with 0, they're 4 times less likely to report feeling empowered, over 5 times less likely to report having positive identity, and 6 times less likely to report social competency. So we can see a strong association between these individual level protective factors and ACEs. However, having empowerment can buffer the negative impact of ACEs. So here we see that 12% of youth with 0 ACEs have less empowerment and reported past year suicidal ideation. So that students with 0 ACEs, 12% of them with less empowerment reported seriously considering suicide in the past year. As did 28% of youth with 1 to 3 ACEs, and nearly half of all youth experiencing 4 or more ACEs who have less empowerment reported suicidal ideation. But then when you put in the empowerment, you can see that this greatly reduces the likelihood of those youth reporting suicidal ideation. So students with 1 to 3 ACEs that have more empowerment are less likely to report past year suicidal ideation than students with no ACEs at all, but that have less empowerment. And even those students with 4 or more ACEs were over 2 times less likely to report past year suicidal ideation if they felt empowered. Similarly, students with less empowerment reported high rates of depressive symptoms, and this increased with ACE score. But even among those students experiencing ACEs, those feeling more empowered were considerably less likely to report depressive symptoms. So I'll move through these next charts relatively quickly as they're similar, and I'm sure you're starting to see a pattern. But empowerment also buffers the association between ACEs and having experienced long-term mental, emotional, or behavioral health problems. And in addition to buffering the association between ACEs and mental health issues, youth with more empowerment, regardless of ACE score, were less likely to report past month marijuana use as compared to those with less empowerment. And the same goes for past year pain reliever misuse. So even youth with 4 or more ACEs were over 1.5 times less likely to report misusing pain relievers in the past year if they had greater empowerment. We also see a similar pattern with past month alcohol use. And because we didn't want to completely deluge you with charts and slides, we do have a handout that you're able to access in the attendee panel that provides data on the buffering effects of individual level factors for each mental health and substance use concern. So even if we didn't include the data in a chart in the webinar, you'll be able to look at that handout and see what the data would be in case you'd like to create any of your own charts for presentations for your community. At the family, peer, school, and community levels, the Minnesota Student Survey also provides data on caring relationships. So by caring, this includes students who feel others care about them either very much or quite a bit, as compared to students who said some, a little bit, or not at all. So while we're not going to explore the buffering impact of each of these in the webinar today, we're going to take a look at a couple, and that handout that I mentioned does include data for all 5 of these caring groups. So in general, youth are most likely to feel that parents and other relatives care about them, and least likely to report feeling that teachers and other school staff care about them, and that other adults in the community care. One interesting exception is that youth with 4 more ACEs are most likely to feel that their friends care about them. But as we'll see in the data shortly, feeling that friends care has less of a buffering impact on substance use and mental health issues as compared to feeling that other adults care about them. So youth with high ACEs are less likely to report past year suicidal ideation if they feel like teachers and other school staff care about them. And importantly, this provides a relatively easy and free to low cost strategy for supporting youth with ACEs by simply working with school staff to coach them on steps that they can take to show youth that they care. And feeling that friends care can buffer students with ACEs to some extent from suicidal ideation. And like suicidal ideation, feeling that teachers and other school staff care can buffer youth with ACEs from past month marijuana use, as can feeling that friends care. But again, as I noted, to somewhat a lesser extent, there's not as much buffering impact from feeling that friends care. So while this might look like a brick wall that you might want to hit in frustration, the reason I included this is I was reflecting on lessons learned and stories shared from Washington State's efforts to address ACEs. Washington's community networks describe themselves as mortar. So each community program, policy, and practice was a brick supporting the overall goal of healthy youth, so reducing trauma and building resilience. And the individual programs received the recognition and credit for the work, but it was really that collaboration of the network that formed a glue that held everything together. So in your community, you might have separate task forces, coalitions, and collaboratives working on mental health promotion, substance use prevention, teen pregnancy prevention, addressing absenteeism, and so on. But working to address ACEs and build protective factors can really serve as a catalyst to unite those efforts and serve as that glue or mortar. Minnesota communities that are funded through the Minnesota Department of Human Services Behavioral Health Division are tasked with implementing the Substance Abuse and Mental Health Services Administration's Strategic Prevention Framework. It's a data-driven public health framework that involves assessing local needs, resources, and readiness by taking a look at local data to see what's bubbling up as the highest priority, and whether or not you have the partners at the table and the resources needed to address those priorities. Working to build prevention capacity at the community level through trainings, gatherings, conversations, and just bringing multiple sectors together to work. Using that assessment data that you collected to develop a strategic plan. So really prioritizing what the biggest needs are and doing research on strategies that are going to be effective in moving the needle. Implementing those prevention strategies throughout the whole planning process, and then always evaluating both the process of implementing those best practices as well as the resulting outcomes. And so using this framework, we can really apply our local level data to assess which ACEs are maybe more prevalent in our community. So for example, if incarcerated parents and caregivers is the most prevalent ACE in your community, perhaps working with recently incarcerated adults who are parents or soon to be parents to prevent passing on more ACEs, and to also build their parenting skills and provide supports to the children they do have. And one of the other handouts that's in the attendee list is a wonderful resource that was developed by my friends at Wilder Research on youth with an incarcerated caregiver. These data are in the infographic are from 2013. They're not from 2016, but they're still very relevant and still tell a great story about how incarcerated parents impact youth and what can be done about it. And recently I did learn that Wilder produced a whole series of these. So we just have one posted on the handout link, but I'll get the others to Becky Dale so that she can post them on the MCCC website. So you'll have all of those. We can also use the Minnesota Student Survey data to identify which protective factors have the most bang for the buck, if you will, in terms of buffering risks associated with ACEs. And we can look at which protective factors maybe have the lowest community level prevalence in your area and therefore need the most enhancement. And all of this needs to be done in consideration, again, as I said, of local resources and readiness to tackle each issue. And on that topic of which protective factors have perhaps the most bang for the buck in terms of buffering risks, we can use the Minnesota Student Survey data to calculate risk ratios. So it kind of gives us an apples to apples comparison. So reading this table as among youth with 4 or more ACEs, how much less likely are they to report suicidal ideation, marijuana use, or pain reliever misuse if they have the particular protective factor listed in the column, whether that's empowerment or friends caring, as compared to those who don't have that protective factor. And from these risk ratios, we can see that positive identity is most strongly associated with reduced rates of substance use and mental health issues among those youth with the highest ACE scores. And feeling that friends care about them has the weakest association, but is still a protective factor, no doubt, just not having as much of an impact. So that's where it's really important to think strategically about which are most strongly associated with buffering risks, but also which does your community feel like you can move the needle on and that you have the resources and readiness to address. So while simultaneously working to prevent ACEs, there are ways that we can use the data to plan for steps to buffer risks for youth who already have high ACEs by enhancing each of these protective factors. So ways that you might share your local Minnesota Student Survey data on ACEs and protective factors could include delivering an in-service for teachers and other school staff, which I know a number of you have already done, conducting lunch and learns at local clinics or nonprofits or civic clubs to share with them how they can boost protective factors for youth in the community, hosting town hall forums or listening sessions to share the data and have community discussions about how you can boost protective factors, or providing trauma-informed training for local professionals like law enforcement and social workers that include both the impact of ACEs on young people, but also steps that they can take to boost protective factors for those that they're serving and working with. Why you might want to share local data on ACEs and protective factors can really help to build buy-in and support for your prevention efforts and show how your priorities, whether that's youth mental health, substance use, absenteeism, relate to your community partners' priorities. So tying it back to ACEs, resilience, and the social determinants of health to show how all of the priorities that your partners are working on are connected and how you can work together to really boost the health of young people through protective factors. And then just raising awareness of local needs and local disparities. And as mentioned, collaborating across those systems and fields to really enhance protective factors. So lastly, I wanted to talk about how you can get your hands on this wonderful data. There's a few different sources. So the first one I want to mention is Substance Use in Minnesota. This is a website that was developed by and maintained by the State Epidemiological Outcomes Work Group. And there you're able to search county level data by specific ACE type. We don't have ACE score on there, but we have data by ACE type. And then we also have a lot of data on the website on protective factors for your county. So you can pull up tables that have these data by grade and gender. You can also produce maps and charts and graphs on that site. And the report that I mentioned earlier on the cumulative impact of multiple protective factors is going to live on the SUMN website in the toolbox. So if you navigate to the toolbox and go under special topics, that should be posted today or tomorrow. And what's really cool about that report is similar to an ACE score, we calculated a protective factor score. So we looked at youth with high ACEs and the effect of having either a low number of protective factors, a moderate number of protective factors, or a high number of protective factors. And that report also includes a planning and prioritization tool in the back that allows you to plug in your own local level data and identify which protective factors most need enhancing and would go the longest way in terms of buffering risks for students. Another way that you can access your data is on the Minnesota Department of Education's Data and Analytics website. So there's a drop-down menu when you click on Minnesota Student Survey data that lets you search by school district and ACE type. So as I noted earlier when I shared that map, there were some counties that didn't have data. This is where you can go to get school district level data. But it doesn't really allow you to analyze the data or create an ACE score or see how ACEs are associated with protective factors, but it is a great tool for accessing that more local level data. You can also request data. While ACE score is not on the SUMN website or on the Department of Ed website, I did run 2016 ACE scores by county and sent those to Minnesota Communities Caring for Children. So you can always reach out to Becky or other staff there and ask for the ACE score for your county if you don't have it. And then lastly, as we are able and have the time and resources, you can reach out to the Minnesota Center for Health Statistics, which lives within the Minnesota Department of Health. They are the keepers of the Minnesota Student Survey data files and are able to run some requests for communities. And then lastly, I wanted to share my contact information. If people have questions and would like to reach out afterwards. But I know now, I think, Becky, we're going to open up the lines and open it up for questions for people.
Yes, indeed. So thank you so much, Melissa. I also just want to mention, many of you probably know and are probably already connected with the work that we at Minnesota Communities Caring for Children are doing in partnership with local children's mental health and family services collaboratives around the state. When Melissa was talking about the Washington networks and mortar, them serving as mortar, the collaboratives are very similarly created and designed to the networks in Washington, and many of the collaboratives across the state, I believe there are 90 of them altogether, and 47 of them so far have connected with us to want to work together on this project. Some of them we've already been working with, some of them we'll be working with as we go forward on this, and so many of those collaboratives will be looking at this data at their local level and doing some of the planning that Melissa described and talked about. So if you're not already connected with your local family service or children's mental health collaborative and are interested in doing this work, that is really a really great way to to participate is at your local level, is through your local family service or children's mental health collaborative. So I just want to mention that. And then I also want to mention, Melissa, hopefully you've all found on the dashboard the place where the handouts are. And one of the handouts is actually Melissa's slides too. So if you want some of those links, you can find them in the handout that is a PDF of the slides. And so if you want those handouts, really encourage you to download them now while we're still on the webinar. We will be, as I mentioned before, posting a recording of this webinar on our website sometime probably in the next couple of weeks. So be patient with us a little bit while we get it formatted and up there. And the handouts will also be there as well once it's up there. So just to let you know where you can find things. And so now is the time. If you have questions, I have the question box open. I don't see any new questions yet. You can either type them into the question box and I'll read them out, or you can raise your hand. I'm looking at and watching for raised hands as well and don't see any yet. So now's your chance if you have questions. On a webinar, I don't like to leave too much silence, although we don't have enough silence in the world, I think. So a little bit of it here and there is nice. I do want to give you time to type a question in if you have one, or raise a hand. Oh, I see a question. Great. Thank you. Okay. Just says great information on websites. Thank you very much. So thank you for chiming in. I think partly Melissa does such a terrific job of laying it all out that maybe we got what we needed.
And I would also, if I can, throw out there that I always love to hear stories about how communities are using their data. Mm-hmm. I often send data out to a community and it's kind of in a black hole, and I know good things are happening, but we don't always hear the stories. So if you're ever willing to share with Becky and MCCC how you've used the data, I think that can really help us provide examples to other communities about what's being done and how the MSS data are being used.
We got a couple of other things come in through the question box. Deb Hengel, thanks Deb, made a comment that these are terrific resources to use with collaborative partners and community. Deb is one of the folks who works closely with Collaborative in Grant County, and Carolyn Sternad from Clay County, also with the Collaborative, asks, she said, can you give us the name of that report you mentioned that will be available tomorrow? And maybe yes, that you were saying, I think she might be referring to the one on the SUMN website.
Right. So it's called The Power of Protective Factors for Minnesota Youth, Findings from the 2016 Minnesota Student Survey Data. And if you go to that SUMN website, which is www.sumn.org, and then once you're on the SUMN website, there's a navigation bar at the top. And one of the features on the website is called the Toolbox. So if you click on Toolbox, there will be a heading called Special Topics. And under Special Topics, there'll be a link for protective factors. So we'll have that report on the cumulative impact of multiple protective factors with a tool. And also in that same toolbox area, we'll have a number of data products that we've created, fact sheets and the like, that give more detail on some of the risk and protective factors that are featured in the report. So yeah, that will for sure be live up there by Friday, but it's probably going to happen today or tomorrow.
And Melissa, is it possible for you to send us the report also as a downloadable report, so we could put it on our website with this webinar as well, and or a link to that place once we get this up on our the webinar up on our website?
Yep, I'm very happy to do that.
Yeah. Rebecca asks that Rebecca says she often gets a question about why weren't 10th grade students surveyed.
Okay, so historically, the Minnesota Student Survey was administered to youth in grades 6, 9, and 12. And so that for your cohort, the survey is done every 3. So those kids who took it as 6th graders took it again in 9th grade and again in 12th. Then everything changed in 2013. There was a legislative requirement to gather certain measures on elementary school kids. And so for some counties, that meant needing to go down to grade 5 rather than grade 6. So in order to keep that same every 3-year cohort, they switched from 6th, 9th, and 12th to 5th, 8th, and 11th. But they didn't want to lose trend data. And so they decided to keep 9th graders in there so that we can look at trends back to 2001 for 9th graders. And then once we do the 2019 survey, we'll actually have trend data for 5th, 8th, and 11th graders. I know that some schools have opted to include 10th graders and 12th graders. It does take more resources to do that, so it's not promoted, but I do believe that school districts have the option of saying that they want other grade levels surveyed.
Thank you. And the questions are pouring in, so this is exciting. Debbie says, our Family Service Collaborative is already working on ACEs. A small group of city leaders met recently to commit to partnering about mental health needs in our community. And these leaders have a history of partnering together effectively. What would you suggest using MSS data as a first step for a community who wants to commit to focusing on mental health as an action step? This is Debbie's in St. Louis Park. So given the community's already committed, what would be a good first step using the data?
Well, some great data from the Minnesota Student Survey on mental health. I think I covered a number of them in the webinar. So you should be able to access your data by grade level for the district on youth reporting depressive symptoms, youth reporting self-harm, suicidal ideation and attempt, and long-term mental, emotional, and behavioral health issues. And I often recommend sharing those data not only by grade level, but if your district has a large enough sample, by gender, because we do see some very significant disparities among females in terms of mental health issues as compared to males. And then also, sprinkling in some of the ACE data that you have, I think would be helpful. And just really finding out what the priorities are of the people who are going to be around the table to see what else they're passionate about and bring that data to them as well. And on that SUMN website, we do have some really easy, user-friendly 2-page fact sheets that have information on the association between ACEs or mental health and substance use. And they're easy enough to print out and bring along with your own local level data. And if you can't find those, every single web page on SUMN has a contact us link. So that email will either go to me or someone else who will be administering the site as of July. And so if you're having a hard time finding anything, any of those fact sheets, most of them are on the publications page. You can just shoot us an email and we'll let you know where they live.
So Chris says that most of the time when she presents about ACEs, teachers and school staff ask what, then what. And she's wondering if you have any particular ideas of resources you can share with school staff to give them hands-on assistance to help build children's resiliency.
You were kind of cutting up and I didn't entirely hear the question.
Oh, okay. I will try it again. The question is really about next things that we can share around building resiliency, particularly with school staff. And I'll actually answer quickly one, and then give you a chance to, Melissa, to say on our website, on the Minnesota Communities Caring for Children website, which is www.pcamn.org, and it's on the slide Melissa has up right there. There is a section where we have recorded webinars, and we actually have a couple of a recently recorded webinar specifically for working in schools. So that I think is very, and it was presented by Dr. Mark Sander from Hennepin County and Minneapolis Public Schools, and from some of our colleagues in Bemidji with Peacemaker Resources, who've done a lot of work on social emotional learning in early grades. And so they're really great resources and ideas and suggestions for things to do in schools and how to approach this in schools. So I recommend that webinar as one source of information. Melissa, what do you have to add?
Yeah, specifically related to data, because that's kind of my wheelhouse, I would recommend bringing the data if they haven't looked at it. And not all schools sit down and dig into their Minnesota Student Survey data, but just bring them local data on the percentage of students who report that they feel like teachers and other school staff care about them. In a lot of communities, that percentage is really quite low, and I think it might be startling for some staff to see, because I'm sure that they care, or they wouldn't be teachers, but just showing them and talking about ways that they can show kids that they do care. And I think also sharing some information with them on the association between ACEs and things like missed school, lower educational engagement, poor grades. And again, we have a number of reports and fact sheets on that SUMN website in state-level data that provide those links. So there's a report about truancy and absenteeism that looks at how much more likely kids are to miss school if they have a high ACE score, for example. So figuring out what those schools really care about and linking the ACEs data to that.
Anne asks, has there been any tracking of protective factors over time? Which ones are increasing or decreasing?
Yeah, so that's one thing that you can do, playing around on the SUMN website. Under data by topic, you can select a protective factor, and then click on your county and look at trend data, again, for ninth graders. That's really the only grade level that we can look at for. And it does tend to vary from community to community. So as I've been with communities, I'll pull up the data for them to see if feeling that others care about them has been going down or going up. And it does vary, kind of depending on the work that's being done in that community over time to boost assets and resilience and developmental relationships.
Cool. So you can see that over time. That's awesome. And then Melody asks, it says, with metro school districts, there can be high mobility rates, so trend data is a little bit harder to view given high mobility. And do you have any ideas how to look at this based on, given the high mobility question?
There is an item on the Minnesota Student Survey that asks youth how many times they've changed schools over the course of the school year, and that number tends to be relatively low. But other than that, I don't really have any thoughts on how to interpret trends, knowing that there is that great amount of mobility. That is something that if you reach out to the Minnesota Center for Health Statistics, they would be able to take a look at your metro area district to look at the percentage of students who are reporting changing schools multiple times and see if there's an association with any particular risk factors or protective factors for them.
And Melody actually has her hand up, so I'm going to unmute Melody. So Melody, you can chime in if you have additional follow-up to this. Melody, your mic is open, so you can speak on this end if you would like to. You may need to unmute yourself because we're not hearing you, but on my end, you're unmuted. Okay, well, I'm still not hearing you, Melody, so I think I'm going to go on to the next question. I'm going to lower your hand, but if you would still like to speak, feel free to raise it again, and we'll try again. And I'll also say the next question is the last one that I have so far. So if you have any more questions, now's a good time to type them into the box so we have them ready to go after this one. Krista says, some of the counties I serve only have 1 or 2 school districts. On the map shown earlier, a few of those were blank. What do we do in this situation where we have data limitations?
So that's where I mentioned the Minnesota Department of Education's Data and Analytics website. So on the slide that's currently on the screen, that's the lower left link. If you go to that and scroll down, you can click on Minnesota Student Survey data from 2013 and 2016. And then you should get a drop-down menu that allows you to search by district. And if the sample size is large enough for that district, you will be able to run the data. It's a little bit clunky. So after you pick your district in the survey year that you're interested in, there are different categories that you can click on. And then you select the grade level. And when I say clunky, you have to search for one grade level at a time. But there you should be able to see the percentage of students reporting each particular ACE item or reporting certain protective factors. And there is a process if you want to get data for districts within your county or within multiple counties that aren't available on the SUMN website. You can submit a request to the Minnesota Center for Health Statistics for a file that has the combination of schools or districts that you're interested in. The one caveat with requesting data from the Minnesota Center for Health Statistics is that there is a process of getting permission from each district superintendent to release that information.
Okay, well, this is the last call for questions. You can either type them in or raise your hand. We're grateful for the questions you brought up. It enriches the conversation and welcome any others you may have. I will leave the webinar open for a couple of minutes just to make sure you have time to get your handouts downloaded if you want them. I will mention again now that you'll receive an email from us sometime probably in the next hour that will have a link to an evaluation. We'd really appreciate it if you give us just a quick couple minutes to fill that out and let us know how this went for you. We do pay a lot of attention to our surveys from trainings and use them to improve future trainings, so appreciate your help with that. And I guess with that, I just see, Melissa, if you have any last words before we finish up.
No, I just appreciate everyone joining us today and expressing interest in your Minnesota Student Survey data, and just put in one last plug for encouraging the districts in your area to participate in 2019 again.
All righty. Well, thank you all for coming today. And we look forward to working with you over the coming year. And I guess that's it. We had one more thank you in the question box. Susan says, thank you, great info. All right. Well, have a great day, everybody. Thanks for being here this morning.
Thank you.
Thanks so much, Melissa. I really appreciate it.
Anytime.